Hi, friends. Welcome. Thank you for joining us today. Vitaboom is thrilled to host this webinar in collaboration with fatty15, the producers of a patented and award-winning supplement containing pure C15, which is a crucial fatty acid that strengthens cells and membranes against lipid peroxidation and slows aging at the cellular level. If you're new to Vitaboom, I'd like to give you a quick introduction before we dive in. So at Vitaboom, we specialize in creating branded, personalized pill packs tailored for your practice. So we design fully customized dispensing boxes that reflect your brand, and you can build specific protocols using professional grade supplements like fatty15 that are available in our catalog. So here's an example of a 30-day protocol we created for one of our partners, Next Health. Each box is branded to their clinic and dispenses daily packets of their chosen supplements for a patient, making it a simple and convenient way for patients to follow their supplement routines. So we have relationships with all of the brands that we carry, with all of the brands of supplements that we carry, and we package everything in our CGMP certified facility in the San Francisco Bay Area. So if you're not already working with us, I'll drop a link in the chat so you can explore Vitaboom. You can explore how it can support your practice. Okay, now on to the webinar. I would like to introduce Dr. Stephanie Van Watson, who is going to introduce you to the amazing benefits of fatty15. Dr. Stephanie is a veterinary epidemiologist with over 80 peer-reviewed scientific publications and 70 patents. Dr. Stephanie discovered the health benefits of C15 while working for the U.S. Navy to continually improve the long-term health of Navy bottlenose dolphins. While seeking to understand why some dolphins were aging at a healthier and slower rate than others, Dr. Stephanie applied an advanced technology called metabolomics on archived dolphin serum to discover which molecules predicted the healthiest aging dolphins. Here, she discovered C15 as a healthy saturated fatty acid. Upon completing 8 key studies over 3 years, she presented C15 as the first essential fatty acid to be found in almost 100 years. Her unique One Health approach to discovering novel ways to improve both human and animal health has been featured on NPR's Science Friday, the New York Times, Inverse, the BBC, National Geographic, and more. So now I'm going to turn the mic over to you, Dr. Stephanie, so you can share your amazing knowledge with all the folks joining us today.
Great. Thank you so much, Deborah. That was a wonderful intro. I appreciate that greatly. And hello, everybody. Great to see you all here, whether you're here now or watching the video. Thanks for joining. I'm going to go ahead and share my screen. Hold on for a second. It'll be an entire screen for a moment. Okay, are we good? Are we seeing the full screen?
Yes. Yeah, that's great.
Excellent. So we are going to talk about, just as discussed, C15, pentadecanoic acid, as a leading geroprotector. So we're going to talk about what geroprotectors are. I had to learn over the last couple of years, and the crucial role of fatty15 in these longevity protocols. Huge thanks to Vitaboom. We're very excited about this partnership. So there, let's talk about, gosh, we've got the dolphin card, right? So let's use it. This is like the best origin story ever of the initial discovery, as Deborah shared, came from this unexpected discovery while taking care of older dolphins, as a veterinary epidemiologist working with the U.S. Navy. My job was not to find a new fatty acid or a new nutrient to help humans. My primary job was to understand aging in dolphins and to help improve their aging on an ongoing basis. So the Navy has taken care of a population of about 100, sustained population of about 100 bottlenose dolphins for over 60 years. They go out into the open ocean every day, and every day they choose to come back. So it's a really wonderful place in San Diego. And what we learned was that, dolphins in the wild while they live to about 20 years old, dolphins at the Navy are increasingly living to 40 and 50 years old, with 2 dolphins this year turning 60. So we have this growing population of older, long-lived, large-brained mammals. And what we were seeing over studies that were done over a decade was that about 1 in 3 older dolphins were developing aging-associated conditions that you see listed here, including insulin resistance and dyslipidemia, chronic inflammation, fatty liver disease, right, with iron overload, anemia, and even the full suite of changes consistent with Alzheimer's, which we just published specific to this population back in April. So once we had that discovery, like Deborah shared, we then were able to apply an advanced technology called metabolomics to look at thousands of small molecules present in the dolphin's archived serum throughout their whole lives, as well as in their all-fish diet. And that's where we were able to look for which small molecule predicted the healthiest aging dolphins. And that's where we found, we were expecting it to be omega-3s, and because all they eat are fish, but instead it was C15. So are you seeing I'm just making sure that it advanced okay. Are you seeing the white slide?
Looks good.
Okay, great. So it ended up being C15 pentadecanoic acid that predicted the healthiest aging dolphins. So this was our first step in a 10-year journey of research of this association between healthier dolphins and higher C15. This is the fancy schmancy drawing, right, of C15. It's pentadecanoic acid. It's just 15 carbons put together with single bonds. They have no double bonds in their main structure, which will play a key part in its benefits that we'll talk about here. So since that discovery, a lot has happened, right? So we now know that C15 is the first essential fatty acid to emerge in over 90 years since the omega-3s. And an essential fatty acid is a nutrient that our bodies require in order to maintain our baseline physiological health. Prior to this discovery, there were only 2 known essential fatty acids, linoleic acid and alpha-linolenic acid, and an omega-6 and an omega-3. And then it took 90 years in this wonderful population of dolphins to find the third, which is C15. C15 is this dietary odd chain saturated fatty acid. So that was another surprise, right? Is that we had a saturated fat, that it is a stable fatty acid with no double bonds, as I shared, which means it's not susceptible to lipid peroxidation. And, you know, when we came out with this initial discovery of it being an essential fatty acid, that is a huge stake you're putting in the ground, right? And we did it after completing 8 studies over 3 years in collaboration with Dr. Ed Dennis, who's the senior author on the scientific reports paper back in 2020. Dr. Dennis was the editor-in-chief for the Journal of Lipid Research for 15 years. And when we got to the end of those studies, that's where Ed said, Steph, C15 is meeting the criteria of an essential fatty acid. Since then, there have now been 4 teams and 4 papers challenging C15 as an essential fatty acid and doing different studies, including the same gold standard study used to identify LA and ALA as essential fatty acids. And all of these studies and independent teams have similarly concluded that C15 indeed meets the criteria of an essential fatty acid. So this is the way science should work. There's an urgent need. So once you have identified something that's essential, that means that if our levels are low, like vitamin C deficiency and scurvy, vitamin D deficiency and rickets, if we have low levels, there will be the presence of a deficiency syndrome. So what we published in Metabolites last year is evidence. It's a culmination of 10 years of data, evidence that C15 deficiencies are present in as many as 1 in 3 of us. It's called cellular fragility syndrome. And this paper goes into detail about the pathophysiology of cellular deficiency syndrome, which I'll cover briefly as far as you're working with your patients, the type of profile that you would see in them. And when we share this, we get a lot of healthcare providers being like, oh my gosh, I have so many people who fit this profile. And now this makes a lot of sense. So we know that cellular fragility syndrome, that lack of C15 in the cell membrane, causes ferroptosis, which is an entirely new way that our cells are dying. This was discovered by researchers at Columbia University back in 2012. 10,000 papers written on ferroptosis since 2012. We know that it accelerates aging, the onset and progression of type 2 diabetes, heart disease, fatty liver disease, and cognitive decline. What nobody could answer is, how did this new form of cell death show up in the first place, right? Because when we all went to our cell biology class, we learned there was apoptosis, necrosis, and autophagy. This is a fourth. So ferroptosis is a huge discovery. And now, again, thanks to the dolphins, help to cleanly reveal that low C15 levels cause ferroptosis. More importantly, restoring C15 helps to fix it. This, again, this was another big stake to put in the ground that we did last year. And this paper by Abbas et al. Was just published in April, reconfirming in a second model that C15 indeed fixes the entirety of the components of cellular fragility syndrome. So great to see that secondary confirmation. So let's talk about ferroptosis. It's this newly discovered cell killer. This graph is in our Van Watson et al. Paper from 2024 in metabolites. So the 3 graphs I'm going to show you, or figures, are in that paper. So, but briefly, ferroptosis is when literally defined by Dixon et al. Back in 2012 as when fatty acids in our cell membrane become fragile, which means they have a lot of double bonds. They become susceptible to lipid peroxidation. And when that lipid peroxidation is mixed with the unexpected presence of free intracellular iron, that results in massive reactive oxygen species that then take and attack the mitochondria and kill the cell. So it is a very unique method of cell death. They called it ferroptosis. And once that process starts happening, which we've been able to show really starts at the level of red blood cells and the liver, that then leads to systemic spillover, right? Systemic lipid peroxidation, reactive oxygen species, and iron overload. And if you do a Google or PubMed search on iron overload, you'll see that this used to be mainly a hereditary disease. It has now by far been taken over by this presence of iron deposition throughout tissues that is being caused by ferroptosis. So what you'll see is iron overload in the liver that then leads to increased insulin resistance and the onset of NAFLD and progression to NASH. Right? These diseases didn't even exist before 1980 when we got lots of C15 from milk. We started taking C15 out of our diet. Deficiencies kicked in, and so did this disease. It also, iron overload happens in the pancreas and the heart, and it should also have in the brain as well, leading to these downstream conditions, which can help explain why we're seeing a rise in all of these conditions, including early onset Alzheimer's in younger and younger people. It's accelerating their aging. So I won't go into great detail because I want to be able to get through the rest of the talk and take questions. But these are helpful guides with regard to when you're looking for, at your patient population and seeing, who's in the greatest need. It's an essential fatty acid, so everybody needs C15, but we are able to define C15 deficiency as having less than 0.2% of total fatty acids, of C15 of total fatty acids in your circulating C15 levels. That results, if you have levels below that, that results in fragile cells, including red blood cells. These red blood cells, because they're fragile, lead to lipid peroxidation, but you have these macrophages, the Kupffer cells inside the liver that then engulf these weak red blood cells. They become overloaded, and that the corpses of these high amount of red blood cell intake in the Kupffer cells results in iron overload. So that's how the iron's getting there. So you'll see things like high serum ferritin with a normal transferrin saturation. A lot of people will immediately say, oh, hyperferritinemia, inflammation. You need to take a closer look to make sure it's not actually measuring and detecting iron overload in the tissues. That then leads to ferroptosis in the liver, and then all of these downstream components that we talked about in the earlier slide. So let's talk about the fix, right? So when you have patients that have signs of C15 deficiency and ferroptosis, then these are the markers that you can use to monitor a response to C15 supplementation. You'll see the red blood cells will become more stable, and that's primarily detected through seeing lowered red blood cell distribution width, right? People who have unstable cells have higher RDW, which is a measurement of cell variability in red blood cell size. They become more stable, your RDW goes down. That's one of the first signs of a C15 deficient person. And if you are measuring lipid peroxidation systemically, you should also see that go down. There's lower liver iron deposition. You're not going to do a liver biopsy, but that's what's been demonstrated in multiple models, and reverse ferroptosis components. So these are the different indices that you would be looking for to look for response. The ones that are most meaningful are obviously resolution of fragile red blood cells, in some cases heading toward anemia, so complete alleviation of that, plus attenuated components of type 2 diabetes, NASH, and cardiovascular disease, including better glucose control, lower inflammation, lower liver enzymes, and lower LDL cholesterol. So let's talk about strength, right? So obviously, if we get a deficiency syndrome, if we don't have enough C15 to stabilize our cell membranes, its job is to keep our cell membranes strong. So C15 naturally goes into our cell membranes. It's a small, stable molecule that is, like we said, highly resistant to lipid peroxidation. We have evolved to use C15 to stabilize our health and to help ensure our longevity. So that's part of the reason why our book from Simon & Schuster called The Longevity Nutrient, with over 100 papers summarized in there, how it got its title. That C15 actually leverages what's called the cell membrane pacemaker theory of aging. This came from A.J. Holbert back in 2005. And what he showed was that the more stable the fatty acids in the cell membrane of a mammalian species, so if you go from a mouse to a human, the fewer double bonds and the more stable the fatty acids, the longer a mammalian species lifespan. So this strengthening of cells through stable fatty acids solely explains how a human or dolphin lives longer than a mouse. This is how evolution has enabled longevity. So it's a true enabler. And now we're saying, can we optimize that, not only to not be deficient, but get it at higher levels to actually help us live healthier and longer. So C15, that's its core role. But as an essential fatty acid, you expect it to do a lot of things. So this is a pleiotropic molecule that has numerous activities. Literally every month, there's a new paper coming out from independent teams throughout the world revealing new mechanisms, new benefits of C15. It's a really exciting time for C15 research. We know that C15 activates AMPK, AKT, and PPARs, which helps to support metabolism, balance immunity. It also inhibits mTOR, JAK-STAT, HDAC6, FAH, and MAOB. We'll go into those in a second. But what's important call out here is that by activating AMPK and inhibiting mTOR, just that alone, C15 is hitting at the heart of the human longevity regulating pathway, right? This is what metformin and rapamycin respectively do. We also know that by doing so, it lowers those senescent zombie cells. It lowers over 18 pro-inflammatory cytokines in a dose-response manner. It repairs mitochondria, slows biological aging. There's a paper showing this is association, but showing that people who have more C15 in their lipids have a younger biological age than their chronological age. This is an ongoing cohort study. It supports the healthy gut microbiome. We'll share components of that, and improves, as you can see, cellular signaling based upon all of these wonderful targets. So today there are over 100 peer-reviewed studies on C15. They're all available. We keep it updated. We just added 2 new papers today at discoverc15.com. And if you go to the resources tab, that groups it by different categories. It's probably your most useful resource. So once we started seeing all of these wonderful activities of C15 coming not just from ourselves, but others, we gained the attention of Dr. Nicholas Shork, who is the head of NIH's Longevity Consortium. He's been so for 15 years plus. And Nick said, Steph, I bet C15 is going to meet the criteria of a geroprotector, right? And I said, great, what's a geroprotector? And that's when Nick shared that a geroprotector is the holy grail of healthy aging, which means that it effectively slows the rate at which we age to effectively stem the diseases that kill us. So it is going to have clinically meaningful benefits within months. And that is what Nick and the Longevity Consortium is looking for, not a molecule that taps into a single pathway and you cross your fingers and hope and pray you live longer. Specifically, C15 and rapamycin have anti-inflammatory, antioxidant, antifibrotic, anti-cancer, and even antimicrobial activities that have been demonstrated not only in vitro but in vivo, again in a dose-response fashion. This toolbox seems a little bit wonky, but if you think about it, if you have all of these tools, you will live longer. And so the paper we published, with Nick and I published in Nutrients, is here, and it details how we compared C15. We put pure C15 head-to-head against rapamycin, metformin, acarbose, and threw in EPA, omega-3 as well, and showed that fatty15 had the most clinically relevant cellular dose response benefits, most closely mimicking rapamycin. So our take home from that story, from that study, was maybe we didn't need to go to Easter Island to get a really complicated molecule that was growing from rare bacteria that, in fact, to meet these safely, right, without the side effects, we all just needed C15, which is a molecule that we all get from birth. C15, speaking of which birth, is essential for infants, and are entirely different groups that are focusing on the importance of C15 at the earliest stages. This includes human studies as well as gold standard mouse and worm studies showing that truly C15 is needed to prevent nutritional deficiencies in neonates, and studies in humans showing that the more C15 mom gets, because she's got to eat it, the higher the C15 in her milk, and the more C15 that baby gets from mom's milk, the healthier that baby's growth, the healthier their brain development, both in the womb and outside of it. And there's a study called the Eden cohort study that's been following kids now up to 6 years old, showing that these kids who got more C15 from mom have better cognitive development, including better language skills. So a lot of exciting work happening on that front. And then also noting that infant formulas that don't have dried cow's milk in it, most of those infant formulas have no C15 in it. So we're really pushing to, as is these groups, to ensure that our youngest are getting their proper C15. Fatty15 is approved for use in pregnant women who are nursing. and all humans that are 4 and older. And we're working on that gap in between up to 4. So that all led to Nick sharing that C15 is the longevity nutrient, and where he shared at ARDD, which is the world's leading anti-aging drug discovery conference in Copenhagen. Nick shared that the breadth of evidence for its health benefits is what makes C15 so compelling. Very few, if any, candidate geroprotectors have been subjected to the same level of rigor in a wide variety of settings: cell-based studies, studies involving non-human species, human population studies, clinical trials, pharmacology studies, and more, and all have resulted in very positive findings. So I'll cover, because obviously a big question is, what clinical trials are there? These are the 4 core ones to share. The first 2 are extensive, robust clinical trials with the pure free fatty acid C15 ingredient that were done by Stallings and Mascarenhas et al. And they showed that C15 has this molecule in particular has 100% bioavailability. There are variations among individuals, but overall it's predictable that every 100 milligrams of C15 that one eats, that their levels, C15 levels, will go up by 1 microgram per mil. So we'll talk about dosing in a second here. The third and fourth studies, the third study was done by a team here in San Diego at Rady Children's Hospital. They focused on young adults who had a history of fatty liver disease. They gave them fatty15 supplementation daily for 12 weeks. And a couple important messages from that. The first was the more that 2 out of 3 of the 30 participants in the study had our definition of C15 deficiency, which is less than 5 micrograms per mil. So that was huge. I mean, we're saying 1 in 3 are deficient. This population, which was purposely picked for people, young adults who were overweight, had fatty liver disease, a history of fatty liver disease, and purposely avoided whole fat milk. So 2 out of 3 were deficient. For those who then took C15 supplementation and got their C15 levels successfully, 1, adhered to the protocol, because that was a factor, and 2nd, got their C15 levels above this 5 micrograms per mil, they saw a significant decrease in AST and ALT, as well as an increase in hemoglobin, right? The sign of stronger red blood cells. Other benefits, things like decreased glucose, cholesterol, those were looked at, but they weren't seen. But it's really important to note that these values were not abnormal in this population, while ALT and AST were abnormally high and successfully brought down. The last study to cover here on clinical trials was done in Singapore. This was to middle-aged women who had a history, again, of fatty liver disease. There were 3 study groups. I'll leave it to you to read the paper, but the take-home point was that the third group that had that included C15 supplementation, they had, above and beyond the benefits of decreasing calories and going on a Mediterranean diet, above and beyond those benefits, C15 helped to lower LDL cholesterol, increase the growth of Bifidobacterium adolescentis. It's a wonderful mama microbe to balance our metabolism, and actually has been shown to extend longevity in worms itself. And then there was a post hoc analysis published just a few days ago on the same clinical trial that showed that the group that was supplemented with C15, they looked at mood, the metabolism mood link, and showed that this group supplemented with C15 had the greatest improvement in lowered anxiety. And we have a lot of growing support for how C15 helps to improve mood. It's one of the most common reports that we get from people. 70% of people on fatty15 report seeing or feeling benefits within 16 weeks. This includes not only improved labs, but improved mood, deeper sleep, and less joint pain. So dosing, active C15 concentrations, these are readily achieved with low C15 doses. So this is not an omega-3 fish oil story, right? Where you need to have really big pills with fishy oil that oxidizes, that can be hard for patients to adhere to. These are tiny pills, and studies have consistently demonstrated that we need to get above our 5 micrograms per mil or greater than 20 micromolars. That's approximately equal to 0.2%, which is most studies report a percentage of C15 among all fatty acids. We're pushing for more teams to report actual concentration, but is approximately equal to greater than 0.2%. We know, again, like I shared, every 100 milligrams of pure C15 reliably increases plasma C15 levels by about 10 micromolars or 1 microgram per mil. That last, the San Diego clinical trial showed that when people took 200 milligrams of pure C15 and fatty 15 reliably, their levels went up by 2.4 micrograms per mil. So exactly as predicted. Most people need an added 100 to 200 milligrams of C15 daily just to maintain, just to not be deficient. But we're now understanding that higher doses may help optimize health, especially related to cardiovascular and cognitive health, as well as with longevity. People who live in the high longevity zone in Sardinia, who have a lower risk of dying from heart disease, their C15 levels are 0.4 to 0.6, so 2 to 3 times higher than the rest of the world, thanks to pecorino and high altitude grass-fed sheep. So longer story for another time. C15 is readily measured in serum, plasma, and erythrocyte membranes. You're going to get the most immediate measurements, of course, from serum and plasma, longer term measurements in the red blood cell membranes. That's probably the most important, but you have to give that a solid 6 months of supplementation to get a reliable reading on that. And then we partnered with Genova Diagnostics to provide an at-home blood spot test for C15 that reports both percentage and concentration. Patients and people, customers love fatty 15. They love these tiny pills. They have no smell, no taste. Again, high bioavailability. We have a 95% monthly customer retention rate, which is almost unheard of in the supplement space. And again, it's because 99% report that they have made fatty 15 part of their daily routine because it's so easy to take. And then they stay with us because they see or feel benefits within months. So with that, why don't I do a quick run through, 10 minutes, or I can pause and answer questions. I will turn to Deborah and team for which you would prefer.
Keep on going.
Okay.
And then another 10 minutes, and then we can do questions at the end.
Okay, that sounds great. Thank you. So knowing all that, let's nerd out one system at a time. When we talk about C15 and red blood cell health, again, this key role of stabilizing red blood cells, what you would see in patients in need of C15, again, these evidence of fragile red blood cell membranes. This happens when we have low C15, but it also happens naturally with age. You'll see declining hemoglobin over time and increasing RDW that may progress to anemia. The beneficial mechanisms of action we've covered well. It just goes in and strengthens the cell membrane. In vivo studies have shown that C15 supplementation effectively stabilizes RBCs, increases hemoglobin, decreases RDW, and it completely alleviates anemia. And in human studies, we've shown there's a epidemiological study showing that people with higher C15 have lower lipid peroxidation and lower and red blood cells with longer lifespans. And again, in that placebo-controlled clinical trial, people who got up and over that 5 micrograms per mil had improved hemoglobin concentrations. This is what we saw in the dolphins, right? This was the first hint we had about the importance of C15 in cellular stability. We put dolphins on a higher C15 diet just by giving them fish that had a higher amount of C15 that effectively increased the C15 levels in their cell membrane. And every dolphin that had anemia in the study resolved within 3 months. And when they went back to their baseline diet, they became anemic again. When we put them back on the modified diet, they got fixed again. So this is where we detected a very clear threshold effect, showing that you need to get above, they had to have cell membranes above this 5 micrograms per ml to keep those red blood cells strong. With regard to liver health and iron metabolism, again, we talked about these fragile red blood cells are engulfed by Kupffer cells. This results in iron deposition and ferroptosis, which leads then to iron overload syndrome and MASLD and MASH. You'll see that manifested as hyperferritinemia with elevated liver enzymes. Beneficial mechanisms of action we've covered. It's just improving the cellular stability, reversing ferroptosis, but also activating PPAR alpha and delta, which are known mechanisms that are liver protective. Lots of in vivo studies now showing repeatedly that C15 effectively attenuates and alleviates iron overload. It lowers lipid peroxidation, the inflammation and fibrosis in the liver. And in human studies, multiple epidemiological studies showing that people with higher C15 have healthier livers, and that in that placebo-controlled clinical trial, they got up and above that 5 micrograms per ml, they had improved liver function. So these are tables from one of the animal studies, again showing that really remarkable, like the iron staining in the liver basically went down to 0 because of this protective function of C15. And these were the data that we already showed in the clinical trial with regard to decreased liver enzymes and improved hemoglobin. With regard to metabolic health, it activates AMPK and AKT, right, which we know is going to improve glucose control. This happens with age and insulin resistance and people who are at risk or have type 2 diabetes. Those are the mechanisms of action, which I just said. In vivo studies have shown that in models of type 2 diabetes, that C15 effectively lowers glucose, lowers these pro-inflammatory adipokines, and lowered cholesterol. And then in human studies, multiple meta-analyses, so large prospective cohort studies showing that people with repeatedly and consistently showing that people with higher C15 have a lower risk of developing type 2 diabetes. For every 50% incremental increase in the percent of C15, the risk of type 2 diabetes was reduced by 8%. So these are graphs showing in cell-based studies how C15 activates AMPK. It surprisingly not only increased insulin sensitivity, but it actually mimicked the activity of insulin itself. So it itself is serving as an insulin mimic, which was a delight and surprise of this Foo et al. Study. When we look at heart health, the addressable pathology, right, is increased LDL, increasingly understanding oxidized LDL, vascular inflammation, and these comorbidities that come with heart disease of type 2 diabetes and MASLD. The active beneficial mechanisms, AMPK and PPAR alpha, both help to lower LDL cholesterol. But in addition, this anti-inflammatory activities of inhibiting JAK-STAT and others will bring those pro-inflammatory cytokines down, so critical for cardiovascular health. In vivo studies in models of obesity and type 2 diabetes, C15 effectively lowered pro-inflammatory cytokines and cholesterol. And in that clinical trial that I shared that showed C15 supplementation effectively lowered LDL, cholesterol, and large-scale studies showing that again, just like type 2 diabetes, people with higher C15 have a lower risk of developing heart disease, a 17% lower risk, as well as heart failure. So here's a picture showing as far as people go from, this is that linear benefit of can we actually do not only not be deficient, but get better over time, that as you increase your C15 levels from 0.2% to 0.5, there is a linear decrease in the risk of developing heart disease. This exact same graph popped up in a study that was just published with regard to C15 and hypertension. 2 more to go. I'll go real quick. That with regard to gut health, there's a really amazing set of studies that have come out with regard to C15 and gut health. We know that C15 directly addresses leaky gut syndrome by lowering inflammation and supporting healthy cells, right? Stronger cells equals a stronger epithelial barrier. and the beneficial mechanisms of action, again, strengthening the cells, lowering inflammation. And in vivo studies, multiple models of inflammatory bowel disease have shown that C15 effectively improved the integrity of the gut lining, so made the gut less leaky, decreased inflammation, and supported intestinal healing. And not a lot has been done in human studies yet, with the exception of that clinical trial showing that C15 helped to improve the growth of healthy microbes, specifically Bifidobacterium adolescentis. So here's these studies with regard to in mice of how C15 helped to improve mouse models of inflammatory bowel disease. These are really remarkable pictures showing the intestinal wall and showing the tissue and showing that when a intestine was aggravated by a toxin, right, DSS, when you added C15, it basically looked like a fully healthy intestine. So really effective with regard to in these models. And the last is cognitive health. So C15, more and more studies showing that it plays an important role with regard to our memory, cognitive health, and mood. We know that our cognitive function decreases with age. It's also linked to type 2 diabetes. Type 3 diabetes is that Alzheimer's. And as we get older, our MAOB and FAAH enzymes increase with age. And as that happens, they increase the degradation of dopamine and endocannabinoids, which is why those levels go down. We now know that, and we just published in April, that C15 in a dose-response fashion inhibits both MAOB and FAAH. And these are relevant to really hard-hitting benefits with regard to neuroprotection, lowered, improved mood, and lowered pain. In vivo studies, compounds that have these activities of inhibiting MAOB and FAAH have shown to lower amyloid beta plaque formation, decrease neuroinflammation, improve cognition. Take those with a grain of salt because we know we've cured Alzheimer's many times in mice and it hasn't transferred to people. So just take that, understand the limitations of that. However, in human studies, this clinical trial, a post hoc analysis that just published showing that the greatest reduction in anxiety were in people who were supplemented with C15. And then there is two epidemiological studies now that have shown people with higher C15 have specifically lower anxiety. So this is the presence and demonstration of Alzheimer's in dolphins that is identical to that present in humans. And then these are the two graphs showing this dose response effect of FAAH and MAOB inhibition as you go from approximately 2 micromolars up to 50. So this is where that higher dose, not only for heart health, but for cognitive health kicks in. So C15 is a leading geroprotector, right? It taps in the longevity pathway. It reverses, which have multiple hallmarks of aging, many of which we've covered. It slows the aging rate through those red blood cells. It shows clinically relevant benefits within months, has evidence of preventing the diseases that kill us, is reasonably accessible for over 50 years of our life, and is safe to routinely use for 50 years. And that is what Nick has been looking for and has been thrilled that C15 meets those criteria. All that is summarized in the longevity nutrient you can get wherever books are sold. And I'm sure our team would be happy to provide copies to those who are interested. Okay, I'm gonna stop talking.
That was awesome. Thank you so much.
You're welcome.
That was great. So we do have some questions, and if anyone else does have questions, just put your question in the Q&A section, and while we still have a couple minutes left, we'll have Dr. Stephanie answer them. So here is the first question I see. Is more C15 better? Should we just get it from food?
Great questions. So the deficiency component, right? So if we have a deficiency that has emerged, right, especially people born since the 1990s, when we really doubled down on saying that kids that once they turn 2 years old, they should go off whole fat milk, right? These are people now in their 30s and 40s. That all suggests that we didn't have this deficiency before, and we didn't have supplementation. So that means that the nutritional deficiency component, there's a chance that it could get fixed, right? Just by going back to having enough dairy fat in our diet. The limitations of that is that, we now know that if cows are fed grass, they have twice as much C15 than cows fed corn. So because of industry changes in the industry, unless the dairy foods are reporting how much C15 is in their specific product, it's hard for us to know. But leaning toward grass-fed animals that produce dairy is probably a good idea. The other limitation of, so the first question is, can we fix it just by eating more food? I think especially in our youngest, getting dairy fat back into the diet, I think could help deal with the crisis that we're sitting on now of 1 in 3 people being deficient. Now, to optimize, the Navy challenged us, right? So all these studies I covered that we've done were all funded by the Office of Naval Research. And so one of those projects where the Navy challenged us and funded us to develop fatty15. They said, can you develop a pure bioavailable C15 ingredient that has the right doses that you can scale up without having to compete with all of the pro-inflammatory fats present in dairy fat? So dairy fat has 1% C15, over 40% of pro-inflammatory saturated in omega-6 fats. So studies have shown that high-fat fed rodents, mice, actually have lower C15. And the hypothesis is that when they have to compete in absorption, C15, there's a lot working against it. So the Navy said, hey, can we just have this pure supplement that can be provided to truly supplement the diet, especially to optimize, get us from that 0.2%, which we could get through dairy, to this 0.4 to 0.6 Sardinian heart health and cognitive health supporting levels. So that's the reason for added supplementation.
Okay, very cool. Okay, and here's another question. What is the source of C15? And I would add to that, is it safe for those who are, say, dairy-free or vegan?
A great question. So, our primary source from the diet, as I mentioned, by far is dairy. And it is so much so that C15 has been used for decades as a biomarker of how much dairy fat we eat. So that's how reliable we are. One of the added challenges by the Navy was not only make 100% bioavailable, stable, free fatty acid C15, but we also want it to be vegan friendly. And so we did that. So it is based on, we take a plant-based C14, which is pure, and we add a carbon to it. So it's bioidentical C15 and 99.8 to 100% pure. And each and every batch is tested for that purity, which really speaks to why we're seeing such high efficacy in our customers.
Amazing. Okay. Oh, here's another question. So say a practitioner wants to include fatty15 in their Vitaboom protocol. Actually, I have two. I'm going to ask the question. I have something I want to add to it too. Okay. So they want to add it to their Vitaboom protocol. Okay. So the question is, how many capsules per day should someone take, I guess? And just in hearing your whole presentation, is fatty15 something that should be considered for a foundational supplement stack? Like, I know a lot of people have low vitamin D levels. So we see a lot of times practitioners add vitamin D to one of their a patient's protocol. Should fatty15 be considered in the same way?
So yes, again, because of all the studies provided, not just from us, who are selling the supplement, it's a lot easier for us to say, like, yeah, everyone should take it. But truly, the science is all supporting. We should all be taking C15. I don't shy away from dairy fat. So there's no way I was C15 deficient, but I experienced the benefits of fatty15. That is the core of my supplement stack. And on top of that, not only do I have incredibly gorgeous blood work, but I'm sleeping better and my joint pain went away. So this should be a core part, and it's very safe to be able to be used with other supplements. It's a great ride along. And then the dosing can vary because it depends on what you're aiming to achieve. So let's start with, you don't want to be deficient. and you don't eat, and you eat some dairy, but not a lot, then 100 milligrams. We have a lot of people start with 1 capsule a day and see how they do. If you're a healthcare provider and you're supporting patients who have underlying conditions that may benefit from supplement support, again, it's not intended to treat, cure, prevent, or manage diseases. But if you have patients that kind of fall in line with this deficiency syndrome, then the higher doses, 200 to 300 milligrams per day, is probably warranted. If someone's been on 1 capsule a day and they're not feeling anything, then we often, within 2 or 3 months, we then have them try moving to two capsules a day. But again, under healthcare provider supervision, it gives you more leeway to go higher. We are about to come out with a higher dose advanced formulation for healthcare providers, so that you can help provide these higher levels to your patients.
Okay, awesome. Thank you. Okay, here's another. Say a patient is allergic to fish oils and cannot take an omega supplement, but wants to support and calm neural inflammation. What dose of C15 would be recommended to replace, say, 1,000 milligrams of an EPA? Understanding they are not equivalent, I'm assuming 100 milligrams would be enough.
Yeah, so that's the comparison that we did, the head-to-head comparison in these human cell-based systems that mimic various disease states with a lot of markers being pro-inflammatory cytokines, right? Showed that C15 had the same anti-inflammatory activities, dose response activities as EPA, and then 3 times more. So it had 36 activities. So it does appear to cover really well this anti-inflammatory component. We know that it crosses the blood-brain barrier and to support cognitive health and decrease neuroinflammation. And then when we look at the mechanisms, both from anti-inflammatory as well as neuroprotective, they all support that going from like 200 milligrams and up to that 300 milligram range will get you more in that sweet spot for specific for cognitive protection.
Okay, great. Okay, next question. How many capsules of fatty15 would I add to a pregnancy stack?
I would stick with the 1 to 2 capsules per day. And the studies have shown, interestingly, in babies, the healthiest babies got about 100 milligrams of C15 from mom's milk. I mean, there's not, interestingly, there doesn't seem to be a weight. Usually it's like the bigger you are, the more you weigh, the bigger your dose. C15 as an essential nutrient seems to be pretty darn consistent with regard to our needs as mammals, as humans. And so, so for mom, having her have at least 1 capsule a day is probably a good place to start.
Okay, great. How do you recommend to balance this with O3 and O6?
Yeah, so they're yin and yang. So if you talk about polyunsaturated fatty acids, which are O3 and O6, they have double bonds. Their job is to have, as you know, omega-3 is anti-inflammatory. Omega-6 tends to have more pro-inflammatory components. Therefore, you need the right balance of O3 to O6. Together as polyunsaturated fatty acids, their job is to help the cell membrane be more flexible, which is important. So you do need those. You don't want them to be oxidized. So you don't want to put in oxidized lipids into your body. So you need to make sure they're super high quality. And then C15 plays the opposite role, which is it has no double bonds. Therefore, its role is to stabilize the cell membranes. So they work together as a yin and yang to have truly healthy cell membranes that are flexible, but also resistant and resilient against age-related breakdown. So they do share anti-inflammatory properties, like I said, omega-3 and C15. But it does appear that there aren't a lot of people who have omega-3 deficiencies, right? We for the most part, we get enough from our diet, and there might be some babies that have some dry skin if they don't have enough linoleic acid. But for the most part, nutritional deficiency syndromes from omegas are very rare, which is good because we're getting enough from our diet. In contrast, C15, again, we're seeing a very prevalent demonstration of deficiencies that happen because we actively took C15 out of our diet. So that's how they would, but they can work together.
Okay, another question. I do see somebody did put an answer in the chat, but any studies for Parkinson's disease?
Yeah, no studies specifically with C15 and Parkinson's. Very smart person asking this question, given that this MAO-B inhibition activity is it's the positive control for this receptor-based study is one of the most common drugs that are used for people with Parkinson's and Alzheimer's, and it's to protect the reuptake of dopamine. And so that, because obviously a big part of dementia, both Alzheimer's and Parkinson's, are the drop in dopamine levels, which then result in the outcomes that we see with regard to memory and movement disorder. So the fact that C15 targets, inhibits MAO-B, similar to this drug, at about 70% efficacy compared to the drug, it's promising with regard to that. But no studies officially have been done on Parkinson's.
Okay. All right. We just have a couple more. How reliable is the blood stick test? Do you also consider PC along with the other EFAs?
The C15 test is reliable. We have done, the good thing is testing for fatty acids the method of testing for fatty acids has been around for a century. It hasn't really changed that much. The methods are well understood. What's really important though is ensuring that it's measuring total fatty acids. C15 gets into all kinds of nooks and crannies, including phospholipids, right? So they are part of triglycerides, they're part of cholesterol esters. And so you really want to know what's your total C15 level versus breaking it down. It is as reliable as measurement of any other fatty acids, including omegas.
Great. If you want to support a patient in lowering LDL along with lifestyle, do you recommend the other types of supplements like niacin, et cetera, along with C15, or just solo supplementing?
I'm a big fan of layering, like trying one thing, seeing how it works, and then layering in from there. So I think, C15 can be a good safe start to be able to, see how that works. Fibrates have been used to lower triglycerides and in some cases LDL, and C15 has this PPAR alpha agonist activity in which fibrates were the positive control for that. So understanding that this is not my area of expertise, really would look to the healthcare provider for what you preferred. It should be a safe ride along, but again, monitoring the patients carefully with combinations.
All right, last question. Someone who hasn't taken full fat out of their diet, would they need to consider C15?
So I'm an example of that. So I love whole fat, my yogurt and granola and cheese and crackers all the time. The ability to, so for example, like I said, I don't shy away from dairy fat. And I don't know what my baseline C15 levels were, but since obviously I take fatty15 every day, and my levels are 0.46. So I'm in the Sardinian zone. I would not be there even if I ate whole fat dairy without that supplementation. So dairy can get you to not be deficient, but whether or not you're going to get those benefits, I didn't sleep better or have less joint pain because I ate butter, right? But I did get that when I had this pure ingredient. So there's some good benefits to just letting it be on its own and not have to compete with other fats.
Amazing. Dr. Stephanie, thank you so much. This was such an amazing presentation and so informative for everybody. we're right up against time, but if anyone, so we'll conclude now, but if anyone has any further questions, please reach out to us and we'll be happy to answer. So thank you.
Thank you. This was such a pleasure. Thanks for everyone for listening along.
Oh.
Bye.